Migraine is more than just a headache. Migraine tends to affect many aspects of our lives and cause considerable disability. Untreated migraines can seem to control your life, dictating if you can go to work or a child's soccer game, limiting what foods you eat, and also causing frustration and depression. During a migraine, people often become sensitive to noises, lights, and smells. This often makes them want to go to a dark, quiet room for a retreat during a migraine episode. And migraine also often causes people to feel nauseated or vomit. There's no x-ray or blood test to identify migraine. Migraine is diagnosed when a person has several typical headache features. The pain is often on one side of the head, and it can feel like a throbbing or pulsing sensation. The pain will typically limit your activities, and you may need to go to a dark, quiet room. You may be nauseated or want to vomit, and odors like smoke and perfume may be nauseated. Finally, bending over with your head between your knees may also worsen your migraine pain. Not everyone with migraine gets all of these features with every headache. You may have a severe throbbing pain on both sides of the head that makes you want to go to a dark, quiet room. Even though the pain affects both sides of the head, most of the other characteristics are migraine features, and for that reason your doctor would diagnose you with a migraine. You may notice different features with different headache attacks. For example, some migraines may cause a throbbing pain and vomiting, while others just cause a dull pain without vomiting. Headaches that limit your activities, make you want to close the curtains, turn off the television, and avoid odors are probably migraines. Remember, you don't have to vomit or even be nauseated for your headache to be a migraine. When you see your doctor for migraines, you'll probably hear everything looks normal. This means that you don't have any other serious illness like a brain tumor, an aneurysm, or an infection causing the headache. This doesn't mean that migraine is imaginary. This just means that today's tests are not sensitive enough to find the abnormalities in the brain that result in migraine episodes. So what causes migraine? Well, researchers still don't know all of the reasons people get migraines. Like many health conditions, migraine is probably caused by a combination of genetic and environmental factors. Migraines tend to run in families. Migraine is more likely to run on the mother's side of the family. About half to two-thirds of migraine sufferers will have close relatives with migraine. The inherited basis of migraine was confirmed in twin studies that showed that when one twin has a migraine, their identical twin, who shares the same genetics, is over 2 times as likely to have migraine compared to a non-identical twin. So many people seem to have inherited a susceptibility to migraine. When a susceptible person experiences a possible migraine trigger, like stress, hormone changes, or certain foods, they're more likely to get a migraine than someone who has not inherited this migraine susceptibility. This sensitivity is probably related to changes in the balance of important chemicals in the brain, like serotonin. For this reason, many migraine treatments will target serotonin balance. The good news for headache sufferers is there are a lot of effective treatments available to prevent and treat migraine episodes. Unfortunately, there's no quick fix or simple cure. With education and the consistent application of headache management techniques, most headache sufferers can significantly reduce their headaches and the impact that their migraines have on their lives.